Meditations. Here we go. Hello, everyone. It's the last day of November, Monday, November the 30th. Since we were with you on Wednesday, we have lost 40 more West Virginians. I hope and pray that as many of you as possibly could have had a happy Thanksgiving. I know for these beautiful families and beautiful people, it's surely anything but that, as now our death toll in West Virginia has risen to 735. I always take the time to read, and I will do that again today, and out of total respect for these people and all the incredible contributions that they've given to West Virginia and all their families, and I ask that you'll please join Kathy and I in our prayers, and I know that God above is understanding and taking all this responsibility on Him, and that's the way we'll get through this. But it's tough and tough and tough on these families. So please, to God above, some way, give these families some level of peace and be with them, and especially be with these that we've lost. Our 696th death is a 79-year-old male from Berkeley County. Our 697th death, a 50-year-old male from Mason County. Our 698th death, an 89-year-old female from Jefferson County. Our 699th death, a 69-year-old male from Cabell County. Our 700th death, an 86-year-old female from Kanawha County. Our 701st death, a 74-year-old female from Putnam County. Our 702nd death, a 75-year-old male from Taylor County. Our 703rd death, an 85-year-old female from Marshall County. Our 704th death, a 57-year-old male from Raleigh County. Our 705th death, an 81-year-old female from Mineral County. Our 706th death, a 47-year-old female from Wyoming County. Our 707th death, a 70-year-old male from Marshall County. Our 708th death, a 98-year-old male from Cabell County. Our 709th death, a 69-year-old male from Preston County. Our 710th death, a 57-year-old male from Jackson County. Our 711th death, an 85-year-old female from Cabell County. Our 712th death, a 68-year-old male from Doddridge County. Our 713th death, a 77-year-old male from Cabell County. Our 714th death, a 72-year-old male from Wood County. Our 715th death, a 92-year-old male from Harrison County. Our 716th death is a 76-year-old female from Hampshire County. Our 717th death is a 79-year-old male from Preston County. Our 718th death, an 87-year-old male from Preston County. Our 719th death is a 49-year-old female from Harrison County. Our 720th death is a 73-year-old male from Kanawha County. Our 721st death is a 47-year-old female from Kanawha County. Our 722nd death is a 79-year-old female from Kanawha County. Our 723rd death is an 82-year-old male from Kanawha County. Our 724th death is a 91-year-old female from Cabell County. Our 725th death is a 97-year-old male from Putnam County. Our 725th death is a 97-year-old female from Putnam County. Our 726th death is a 68-year-old male from Wood County. Our 727th death, a 97-year-old female from Greenbrier County. Our 728th death, a 97-year-old female from Mineral County. Our 729th death is an 84-year-old male from Marion County. Our 730th death is a 79-year-old male from Monroe County. Our 731st death is a 93-year-old female from Brooke County. Our 732nd death is an 87-year-old female from Brooke County. Our 733rd death is an 89-year-old female from Ritchie County. Our 734th death is an 80-year-old female from Kanawha County. And our 735th death is an 84-year-old male from Cabell County. You know, the reason we're a little late starting today, and I don't know that there's any point in the world in we should be willing to accept and recognize anyone and everyone's opinion. But outside of the Capitol right now, you've got 30 or 40 people, and what they're protesting, and they had to be moved back because none of them have a mask on. They're protesting, they don't want to wear a mask. We had 40 more people die. 735 West Virginians. We're within a very few days of starting a vaccine. The only thing we all know, the only thing we can possibly have to be able to slow this thing down right now is that mask. That's all we got. That's all we got. I don't understand it. But there are those that have a different opinion. We want to accept their different opinion respectfully, but they had to be moved back from the Capitol to be able for me to get in here, and they really need to be wearing a mask. Our daily positivity rate in the state of West Virginia now in the last 24 hours is 7.07. I'm telling you, this situation is really critical. Our cumulative positive is at 3.64. Our active cases are 16,785 in West Virginia. We have record high patients hospitalized, 597. We have 162 in the ICU units. We have 40 dead. You know, it's great to count. We got 162 in the ICU units. How many of those are going to die? How many more are going to die to nursing homes, or how many more are going to die from this? And absolutely, you know, you depend on me to react, and that's what I'll do. Since last Wednesday, we tested 97,935 West Virginians. and our reproduction rate of RT value is 1.00. And that's the 15th best in the entire country. What does that tell you, West Virginia? It tells you that all across our land, people are dropping like flies, and West Virginia is not immune. We have 8 red counties today in West Virginia: Ohio, Marshall, Mineral, Grant, Ritchie, Wirt, Mason, Wyoming. 15 orange counties, and I'm not even going to read those. Now let me tell you just this. Yesterday, upon the direction through a real concern, Albert Wright is genuinely, really concerned that our hospitals are going to be overrun. And so, in a phone conversation I was having with Clay Marsh, I said, not anybody, I said, at this point in time, if truly we are going to be overrun with our hospitals, if truly we are going there, we need to move immediately upon that guidance to stopping the elective surgeries. Well, in that discussion, Dr. Marsh said to me, he said, Governor, is it the best move we can make to stop the elective surgeries that are going to basically lead to hospital stays and all that, and take up beds in the hospital and all those kind of things? And that's what we're going to have to do first. You see, over and over, every day that we have these briefings, we're asked over and over and over, where do we stand on hospital beds? Where do we stand on capacities and all this kind of stuff? And we have our medical team and our medical experts answer that. But with the concerns of the hospital associations and everything, we have now decided, and now you're seeing right now, a significant cutback in the elective surgeries at our hospitals in order to ensure that we will have hospital space. We're only cutting back, electives that do not require overnight stays, and I'm sure we can get more into that with our experts and your questions to our medical panel later on. On a vaccine update, and this is the beatinest thing that I have told you, that I felt like that we would have vaccines in the state of West Virginia on the 11th or the 12th of December. I think I'll be right on that, and it's a 2-dose thing. Moderna is moving to get their emergency filing and authorization, and they're with the FDA today, and they are behind Pfizer, who filed last week, and we expect the first doses of the vaccine, like I said, to be here the second week in December. Both vaccines report to you that you've got to take 2 doses of it. And the doses are from 3 to 4 weeks apart. There'll be a limited supply in the beginning, but it will ramp up, and it will ramp up very, very, very quickly. I think between the 2 of them together, and maybe there's a third one, and I'm not going. I know there's a third one, but I can't recall the name. But between all that, there's approximately 40 million doses that will go out across our country and everything, and it will be ramping up every day. I'd strongly encourage everyone, through the FDA's authorization, through the CDC, through all the medical teams and everything, to take the vaccine. Our Vaccine Advisory Council has been working since August. General Hoyer heads up the efforts in this charge and everything. I think we're going to be ready. I think you'll see them move like I know they can and everything. We'll handle the distribution of that, and they'll do a marvelous job there. Our face covering requirement, is still out there. It's at all times in public buildings, and we've got to be able to maintain social distancing. If you need signs and everything to put up at your business, do so. But for crying out loud, if you can't hear these heeds of warnings, then you're not listening to even those that are crying from the grave. 735 West Virginians are crying out to please try to protect yourself and please stop this thing as fast as we possibly can. You know, the testing after the holidays is all up, you know, where you can go, and the free testing maps there, and the drive-through pharmacy stuff. Again, thanks to Fruth and Walgreens and all the stuff they're doing. The education map came out on Saturday. We had 8 red counties. The education map was released Saturday. If it was updated today, because more counties turned red, there'd be 8 counties red that I've already named, and the counties that I've named in the orange and the gold. The school outbreaks, we have 24 school outbreaks with 106 cases. The schools really and truly are still a pretty daggum safe haven. We have 111 outbreaks in our long-term care facilities. Our churches, we have 21 outbreaks in 15 counties. I always read the counties: Berkeley, Cabell, Fayette, Harrison, Jackson, Kanawha, Logan, Marion, Mingo, Monroe, Raleigh, Taylor, Wayne, Wood, and Wyoming counties. And if you know, in those churches and everything in those areas, please be super careful. Please, if you decide to go to church, you know, absolutely wear your mask and stay that pew apart. We're only on a short fuse now. We hope and pray this vaccine's really going to help us stop this thing, but we've still got a ways to go. In corrections, we have 40 active inmates across 8 facilities now. You remember when I reported to you on, I guess, Wednesday and said we've got a situation at Denmark and, you know, we've got a few cases there. Well, now we've got 54 there. And I told you we had a few that at the Northern Correctional Facility Regional Jail, and now we have 40 there. You know, I told you we had a few at Pruney Town, and now we have 22 there. You know, we all have got to see how this thing spreads and how it spreads so quickly. And we've got to do any and everything we possibly can to try to slow it down. That's all I'm trying to do. Our flu vaccines available to you, we're at 193 million and change as far as people that have been applying for the cities and the counties, and we've continued to take those. You know, West Virginia Black Bears announcement. West Virginia Black Bears today announced that they will be one of 5 teams selected by Major League Baseball to be a founding member of the new Major League Baseball Draft League. This new league will be sanctioned by Major League Baseball and operated by Prep Baseball Report, one of the country's biggest and most respected amateur scouting services. Each season, the Black Bears roster will be filled from draft-eligible collegiate players projected as premium selections in that year's Major League Baseball draft, ensuring Black Bears fans will continue to enjoy high-quality baseball action along with all the fan-friendly activities that go on at a ballpark. I am truly excited to hear that the Black Bears will continue in Morgantown as a member of Major League Baseball draft. Now, the Black Bears are an important part of the north central part of West Virginia's economy, as all of our minor league teams, and we're working them in every aspect with the Major League Baseball people. And ever since it was rumored that Major League Baseball was considering downsizing, I have worked constantly to ensure our teams would continue playing in West Virginia, and had multiple conversations with Major League Baseball Commissioner, Rob Manfred, and his staff. And I'm grateful today of this commitment. I hope there's going to be more commitments right around the corner. We're working them all, and I hope we're going to be able to play ball in the years to come and play ball right here in West Virginia. It's an important fabric in our lives, and it's important to our communities, and so we're working it. We're working in a lot of different ways. Today we have a killer in our midst, and we're working that first and foremost, and we're going to stay on top of it with every single thing we got. Nevertheless, I do want you to look at our graphs just one second. Jordan, if you'd put that up just a second. If you'll look and you'll think back to somewhere, and I don't really exactly have the dates, but somewhere around the end of October, the top graph, if you'll look right through that, if you'll go back there on that graph, I don't know, 1/8 of the way, you'll see a widening in that area. And since that time, it's gotten closer and closer and closer together. This is recovered cases versus active cases. Recovered's on the top and active's on the bottom. Recovered's surely not going up as fast as the actives are, and that's not good. We want that to widen and widen more and more, and it's not. It's narrowing. In the next line, that's our daily positivity number. And we bounced along through October, and really and truly, we had more days under that dotted line than over. Now look what's happening. We're just bouncing and bouncing and going higher and higher. The 7.07 is the highest it's been since the end of April. Think about that. The 7.07 is the highest daily percentage it has been since the end of April. Our cumulative positive, it continues to grow at 3.64. Anybody in the world can look at this and say, anybody that would look at it has to say, we got a real problem. Anybody that looks across our land in America, you got a bigger problem. What are we going to do about it? Sit on our hands and not do anything? That wouldn't be very bright, would it? So we're going to cut back on our surgery so that we'll be able to have space. We're looking really, really, really hard at pinpointing some of these counties, some of these areas, and having to go to more stringent mitigation. And absolutely, it may very well be that on Wednesday, we have to announce more stringent mitigation in those counties to be able to slow down just the fact that our bordering counties, we have got to slow down people coming over here from across the lines, maybe at hours at our bars or whatever it may be, but we're working every aspect of it. We've been working it all weekend. We're going to continue to do just that. And we're going to continue with all in us to do all that we possibly can do. Now, get this. Let me just tell you just this. If we do all in us, and it's all we possibly can do, and it only helps one person, one death, isn't that enough? For all those that don't believe in the mask and don't believe that it matters and everything else, which is not true, but for all those that don't believe, what can it hurt? What can it hurt? An inconvenience? You may say, well, we put that mask on and we don't wash it, and we put it back on, we don't wash it. Well, yeah, my gosh, you gotta wash. You gotta wash your hands. You gotta stay socially distanced. Come on, that doesn't count. Well, I can't breathe very well in wearing that mask. Well, if you can't breathe, we have made exceptions for that all along, have we not? So the bottom line of the whole thing to me is just this. If you wear this mask and it doesn't help much, but it helps a little, why not do it? And the other flip side of it is all the medical experts from here to the cows come home. Every one of them say it helps a tremendous amount. But even if you believe in your mind that it doesn't help hardly any, well, that hardly any could very well be one of your loved ones. And so, absolutely, that's all we've got right now. We're days away from a vaccine to start. Do we all not understand that this disease, to stop this disease has got to go from Harry to Mary to Jim. If it doesn't go, if Harry's got it and Mary is vaccinated and can't get it, or Mary's got her mask on and Harry and Jim have got their mask on and it can't get to Mary, then it can't go any further. That's how you shut it down. It is absolutely a chain reaction, and we are the chain. We're the chain. That's why Dr. Marsh has told you so many times, we have the power. We're the chain. If we don't let it move from people, from person to person to person in our chain, we stop it. I don't know about you, but I really, really care. And I know West Virginians really, really care. And I know how much 735 great West Virginians have meant to all of us. Just sitting on the sidelines and saying, well, there's nothing we can do. Let's just kind of hang out and see what happens. That's not acceptable to me, and that's not what I'm going to do. I'm done, Jordan.
All right, thank you, Governor. Next, let's go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. The governor has, I think, very nicely presented news to each citizen of West Virginia for where we are right now. And as we think about West Virginia's status, we reflect what's going on in the rest of the country, but are a microcosm of that. We're a small picture of that bigger picture. And we know that we are seeing more West Virginians test positive on a daily basis than we've ever seen before. We also know that almost certainly when we see an increase in the number of daily new positives, that in about 2 to 4 weeks after that, we will likely see more people be hospitalized. We're seeing that in the country, and we're seeing that in West Virginia too. We now have more West Virginians in West Virginia hospitals than we've ever had before, more West Virginians in West Virginian ICUs than we've had before, and also more West Virginians on ventilators from COVID than we've had before. Now, I think that as we have constantly talked about this pandemic, one of the things that we have said reproducibly that one of the biggest risks for us as a state is to see a surge happen, a rapid increase in the number of people that are going to hospitals, to hospital emergency rooms, and going to hospital beds and ICUs. Because after a while, that consumes a lot of the resources of these hospitals, and particularly our most sophisticated hospitals in our state. And then people who need to come into those hospitals for cancer care or heart care or strokes or infections start to have problems finding beds. And just like everybody else who lives in the communities we all live in West Virginia, the hospital workers are also exposed to others who may have COVID-19 and not know it. And so people in hospitals or in healthcare settings or in nursing home settings also can get sick, which places a further burden on that capacity requirement that we have. And everything is all connected. So once the smaller hospitals in smaller communities in West Virginia get to be more sort of impacted by sicker and sicker people who may have COVID-19 who are seeking care, that starts to increase the drive to transfer those people to the larger hospitals and the more sophisticated hospitals in our state. And then we see the bigger, more sophisticated hospitals in our state start to get into trouble because they start to lose the capacity. And as the governor had instructed us and to all the hospital CEOs and leadership's credit, along with the hospital association, there is a great willingness for all hospitals to work together in series to make sure that we are maintaining that critical capacity that we need in the state of West Virginia, and that we can keep our most sophisticated hospitals, the ones that can provide the most cutting edge complex care that our citizens may need as the pandemic goes forward, open and available and maintaining that capacity. But as the governor said, and I won't repeat his very, very articulate way that he expressed this, it's on us as citizens of the state to be very mindful and do everything we can within our power to reduce the drivers to continue to see this acceleration, because we are starting to see the first surge that we've seen in the state related to the hospitals. And we will, with the hospital, again, with all the hospital's leadership and commitment to service to the state and to helping each other, we will be able to maintain capacity at this moment. But what we see is that perhaps the worst days are ahead of us as everybody goes inside and as people may not, may be against wearing masks and physically distancing and staying with the people that they're around the most anytime they can, avoid crowds and closed indoor spaces and contact with people that you don't know. Because what we're seeing now is this is starting to accelerate around our country. And we're seeing the first parts of that acceleration in West Virginia. So it really is up to us, because as we look at our border states, Ohio, Pennsylvania, we see much more COVID activity there. We see a lot of reflection in the counties in West Virginia that border these areas. We see the infection rate that the governor and I have both talked about going up. In many of our counties, we are getting into the red area, which suggests that we are seeing transmission. And as we've talked about, because we are testing a lot more, we would anticipate that we will see more cases, which will initially make that infection rate go up. But if we're really controlling it, that infection rate will start to come down. And in many of our counties, we see it continue to go up to, double or triple the sort of the line in which we say is red, which is 25 cases, new cases on a 7-day rolling average for 100,000 population. We're seeing counties with rates of 50 per 100,000 population, 75 new cases on a 7-day rolling average per 100,000 population, and even 1 over 100. So that really says to us that we really need to push down the brakes as much as we can on those drivers. And the key that the governor has said, and I'll just reinforce and then I'll be done, is that each one of us has the power to put on those brakes. And the governor's talked a lot about running to the fire. Well, this is a new kind of fire for us to answer. And it's one that the National Guard can't solve by itself. The DHHR can't, the governor's office, all the leaders can't solve without the commitment of each citizen to make sure that you are applying the brakes on this spread in your own communities and your own behaviors and your own activities. And with that, we'll make it through this fine. But West Virginia, make no mistake about it, we are entering a new part of this pandemic, and it's one that poses threat to us if we don't act vigorously, consistently, and altruistically. So thank you.
All right, thank you, Dr. Marsh. Next to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Just like to highlight a couple of things, reinforce what the governor and Dr. Marsh have talked about. In about less than 10 weeks, we have seen 3 times the growth in COVID patients in hospitals. In addition to that, we see consistently somewhere between 44 and 50% of our total fatalities come from nursing home patients. We're seeing that it's not just a bed issue or availability of bed, but it's also staffing issues, and that staffing issues come from community spread. We also know that the fatalities in nursing homes tend to come from community spread related to staffing issues. So again, we're trying to reinforce as we stand up today, the Joint Interagency Task Force officially that's been planning since August for vaccine distribution, that the governor has us focused on two key general priorities, excuse me, right now. First is maintaining the integrity of our acute care healthcare system. And the second is to minimize the number of fatalities in nursing homes. We know that the average age of those that we have lost is 77 years of age. It requires significant healthcare resources to protect our population that the governor's talked about in the past, that we have one of the highest rates of comorbidities in the country. So we'll continue to focus on that. The Interagency Task Force will begin to pivot some National Guard resources from testing to the vaccine distribution planning and execution, and DHHR will continue to maintain strong community-based testing going forward. Thank you.
Thank you, General. Next to Bill Crouch, Secretary of the West Virginia DHHR.
Hello, everyone. I want to give a note of thanks to our DHHR employees and others, but we have had a long weekend. We have staff who have not had days off since March. We have to keep things going. As you've noticed, looking at the dashboard, we've actually had 3,660 new cases since Thanksgiving Day. So we've continued to make sure that everything is updated. And I want to thank them for their tireless effort and to keep the public informed during this pandemic. Also would like to thank the local health departments and the National Guard. We had a lot of folks out this weekend making sure that individuals who tested positive were isolated, and that we had folks self-quarantine. And we kept testing going. It was a little drop in testing, but we continued that effort throughout the holiday weekend. As the governor mentioned, we're in for a bumpy road for the next few weeks, and we want to make sure everyone follows the guidelines as best they can. Please continue to test. We must continue to identify individuals who are positive, to isolate and make sure individuals who are in close contact with positive self-quarantine to reduce that community spread. Every individual that we identify through testing reduces community spread if we get those individuals to those individuals early. Also, vaccines are coming, as we've talked about. But until vaccines come, we ask everyone to wear your mask a little bit longer. Please follow the governor's orders. You will be saving lives. So thank you very much.
Thank you, Secretary. And last from Dr. Ayn Amjad, our State Health Officer.
Good afternoon. I just wanted to mention a few things. We have 91 nursing home outbreaks. We had 9 new ones since the Thanksgiving holiday. Of those 9, we did find 2 new outbreaks with the governor's executive order for testing of staff. And that does highlight the testing of asymptomatic people. So I do want to remind everyone to continue testing throughout the state, and to thank also everyone who's been helping with those efforts. But that does highlight the need for testing asymptomatic carriers, and it's going to help us with our nursing home outbreaks. Thank you.
Thank you, Doctor. We'll now go to questions from members of the media. The first today is from Steve Adams with Ogden Newspapers. Steve, we can't hear you. You may be on mute. Looks like we're having some. Oh, there he is. We got you now.
Hey, there we go. Steve Adams, Ogden Newspapers here. Can somebody give me a little bit more details on what the actual plan is in regards to elective surgeries? I heard one specific thing mentioned in regards to, limiting elective surgeries to surgeries that don't require overnight stays. Were there any other agreements or any other things that were agreed to between the state and the hospitals and the hospital association regarding that? Thank you.
Dr. Marsh, maybe you could.
Sure, Governor, happy to. Thank you, Steve. So this morning we had a call with the Hospital Association and our largest group of hospitals and hospital systems in the state. And what we agreed to was that each system has their surge plans. And so we asked them to update those and to where we are now to reflect the idea that looking at surgeries that will be done over the next 45 days or so as the initial time frame, to look at not doing the kinds of surgeries that can be put off, that aren't urgent or emergent, that people need to stabilize their medical care, and to look at prioritizing, particularly putting off those surgeries that require an inpatient stay that would take up a hospital bed. So for instance, the discussion that the governor and I had yesterday was trying right now to delineate the surgeries that would be, say, for cataract removal or something else that could be done as an outpatient versus the surgeries that would tie up an inpatient bed or an ICU bed particularly. So each system will submit their current plans and how they will do that to the hospital association. We will then look at those plans and make sure that we are all communicating and helping each other out so that we can not only look at increasing capacity by doing these kind of measures, but also start to look at systems in our state that may have more capacity than other systems, and looking at ways we might be able to balance out some of those challenges that certain parts of our hospital system in the state is having with the volume and the speed of people coming to the emergency room and into the hospital with COVID. And we see that in a more location-specific part of our state, and particularly the parts of our state that border Ohio and some in Pennsylvania seem to be the places that we're seeing the most activity. But as we said, because of the connection between the higher acuity, the higher sophistication, more cutting edge parts of our state hospital system, the referral network is always moving from the smaller hospitals to the larger medical centers and hospitals that have more sophistication. That over time starts to pressure those larger hospitals because they then get overly full. So we're looking at all those elements. I hope that answered your question, Steve.
All right, thank you, Stephen. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Governor, in light of what happened over the weekend with the Western High School football Super Six and the decisions which were made, several coaches and athletic directors have been talking and reaching out. Is there a pathway forward for either individual schools or counties in the state to apply with your office for CARES Act money to replace lost revenue that they've experienced this year because of the pandemic due to ticket sales and cancellation of games? As you well know as a coach, it's mostly football and boys basketball which pay for all of the other sports at just about every school. And those expenses continue even though the revenues have been severely choked off. So from your standpoint, is there a path for either counties or individual schools to apply to your office to see if there's a chunk of CARES Act money they could get to help offset those costs? Thank you.
Okay, Kenny, this one we've been on for a long time. And we're still on it. We're still trying to work through a possible way. It cannot be done just as a simple replacement of lost revenue. We do not have the ability. Remember way back when I kept believing with all in me that the Congress would move to where we could replace revenue. Well, they're going to end up doing that, but they have not done it yet. And so that's an issue. But this is not like new news that a football coach or an athletic director has called you about, and then we're bringing it up now. We have been on this, and we've been on it for months, and we've been trying to figure a way that we could do this. I have not given up on this, and I'm still working to try to find a way. And at the end of the day, I'll find a way. But right now, what would really help us to be able to move this needle and move this needle very aggressively and be able to help our schools all across our state and our athletic programs is just tweaking in the guidelines or the rules, and Congress has to make that. And as soon as we either get there or we find a way to do it without getting there, we'll absolutely jump in with both feet to try to help our schools and our athletic programs, because you're exactly right. Basketball looks in real jeopardy to me, and I hate it like crazy. And football, we've already lost the primary driver in all the revenue that is supplied to our athletic programs all across the spectrum. The three drivers are real simple, and that's football, boys and girls basketball. And those three sports are really feeding the bulldog for all the other sports that are going on, which are really important, and really, really important to our kids and our families and everything. And so, but if we don't have income from those three sports, we're in real trouble. And so I'm going to stay at it. We're going to get it done, but we just can't do it right now under the guidelines of what they are.
All right, thank you, Kenny. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everybody. Hope you're well. Yesterday, on a national news broadcast, the infectious disease expert, Anthony Fauci, advised, quote, "Close the bars and keep the schools open." Fauci continued by saying, quote, "Obviously, you don't have one size fits all, but as I said in the past, the default position should be to try as best as possible, within reason, to keep children in school or get them back in school. West Virginia's map affects school, but not other gathering places such as bars. Are West Virginia's priorities still correct, or do they need an adjustment? Thank you."
Brad, you're right. It is a very difficult balance. I mean, here's the balance. From my standpoint, without any question, if it came down to close the bars and keep the schools open, I'm all in. I'm all in. But from the standpoint of really and truly what the electorate, what the business owners, the fairness, all those complexities that come into play are there. From the standpoint of the teachers and the unions and people saying, well, we don't feel safe being in school right now, so we're not going to go to school, and counties deciding, well, they're not going to have school, when really and truly the numbers look pretty dadgum good. Dr. Fauci is good. There's no question he's the most renowned expert in the land. But let's be fair, Dr. Fauci has been wrong too. And the reason Dr. Fauci is wrong is because Dr. Fauci, nor Jim Justice, nor any of us have ever dealt with anything like this before. And the very, very best that we can possibly come up with, from time to time, we're going to be wrong. So with all that, from my standpoint, Brad, we're watching. We're absolutely, if we could just shut the bars down, and absolutely we could go to school, and that would dramatically curb this thing, I'd be all in right now. But there's a lot of factors that are going into play here, and we're trying to depend on our health experts and our health community and everything to be able to guide us through this from West Virginia's standpoint. You know, if you just close the bars down and pick a county that's blazing red, you know, you just close the bars down in Wyoming County, and really and truly the county stays blazing red, the first thing that's going to happen is the teachers are not going to feel safe. And so the teachers are going to say, well, we're not going to school there. I mean, it's a very, very difficult balancing act, and we're trying to do the very best we possibly can, and we're going to continue to do that.
All right, thank you, Brad. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. I want to go in a little deeper on the hospital situation. There are a lot of community hospitals out there that aren't very big, and if there would be a rush toward the hospitals, they would be overwhelmed rather quickly. Are there any tripwires on the way, like a 90% capacity, 75% capacity, where you would make moves to transport some people to other hospitals in the state as referred to by Dr. Marsh, or would you stand up a National Guard hospital in some areas?
Paul, our experts can answer it better than I, but Paul, the answer to that question is, you know, without being a smart aleck in any way, is, you know, sir, do you like your eggs scrambled or fried? And the answer is yes. You know, in the situation that we're in, you know, whether it be St. Francis or Fairmont or where, you know, transporting or standing up a National Guard hospital, or we're going to do whatever we have to do. I mean, that's all there is to it. You know, now our experts can answer that, you know, maybe if they choose to do so, but at the end of the day, we're going to watch and monitor this as best we possibly can, and that's why we're taking the move that we're taking right now to see that we do not get into that situation. But Paul, you're exactly right. That's a concern. And when you sit here and you read 40 people that died since last, and the days are all running together, since last Wednesday, you know, and you look at what's going on all across our country, you know, Paul, you gotta react, and that's what we're doing.
Governor, if I could just add one thing.
Surely.
So, Paul, I would just also want to make sure that we're communicating well. So we still have capacity to take care of people with COVID in our state. We still have capacity to take care of sick people with COVID in our state. And what we're starting to see, though, is that part of our bigger hospital systems, and the governor mentioned Albert Wright, who is the Chief Executive Officer of West Virginia University Health Systems, which is our largest system. Albert has reflected that there's been a lot more activity that's accelerated, particularly in Wheeling and in Parkersburg, that's led to an influx of more people coming into Ruby, which is basically started to create a bit of an issue that we're just starting to see there, where we don't have as many immediately available ICU beds as we may normally see after a Thanksgiving holiday. But that's the reason why, with the governor's guidance, and really with the leadership of all of the hospital systems and the West Virginia Hospital Association, along with our pandemic leadership group, that we are now working to come up with active measures to make sure that we are prioritizing, you know, the different activities that these hospitals are normally do, so that we can maintain that capacity. We know that smaller hospitals may not have that same ability to free up capacity, so we're watching the smaller hospitals very carefully as well. But I think that it's important for us to make sure that we're communicating well, that we are starting to see that surge that's happening at the hospital level, and we're acting very aggressively to maintain capacity, as the governor has said. But that's a reason why we need to cut this surge off now, which is the reason why we're pleading with all of our citizens to really double down in their use of their own ability to control COVID spread. As the governor talked about that chain, break the chain by wearing your mask and physically distancing. So thank you.
All right, thank you, Paul. Next to Haley Kosick with Nexstar Media.
Okay, hi, Governor and panel members. Through conversation and word of mouth, many West Virginians have said that they don't trust the vaccine that will soon roll out to the public, and that when the time comes to get the vaccine, they will happily decline. Do any of the members have a comment to these feelings on the vaccine?
Well, let me answer this. You know, we're proving to ourselves that we know how to die. You know, I mean, we can look down and prove to ourselves that every single day, that we're walking in here, it's 28, 27, and now we went through a couple extra days on a holiday and everything, so it's 40, and really, if we don't do anything, I don't know that there's one person, well, there's got to be, because there's people, you know, protesting not wearing a mask, you know, or they don't want to wear a mask. But I know very few people, and nobody that I know that's in the medical community that's going to say the best thing we can do is do nothing. Just do nothing. Just sit back and hope and do whatever we want to do and hope and pray that this thing's just going to go away. You know, nobody believes that we're going to quit dying. And so in other words, I would say we've figured out how we can die. Now we've got to figure out how we can live. From the standpoint of people being concerned about taking the vaccine, you know, we have got to depend on people, you know, our FDA, all the different people that are experts beyond belief. From what I'm told, through all the thousands upon thousands that they've tested and they've run these trials and everything else, for the most part, I really don't know anything worse than you get the vaccine, and for a few hours after that vaccine, they do have people that have, you know, have reacted to it where they feel a little flu-like symptoms or they feel a little sick for a few hours. But then after that, within a very short period, less than 24 hours, they're fine. Now, sure, in everything we do, I mean, we've got to be smart enough to realize when we get out of the bed, there's risk. I'm telling you, we know how to die. And me, we've got to learn how to live right now. We've got to learn how to stop this pandemic and live. The vaccine is an opportunity for us to live. If we all believed, well, we don't want to take the vaccine, let's just take that course. We all believed we don't want to wear a mask, we don't want to take a vaccine. What do you think the chances of not repeating the same Groundhog Day are? They're zero. We're going to die. And so if that be the case, let's try to live. I don't think we really need anybody else to comment on that. It's just as simple as that. Sure, there's always a risk with anything and everything you do. From what we've been told, the risk of taking the vaccine is so minuscule, it is off the chart. I think that people will overwhelmingly take the vaccine.
All right, thank you, Haley. Next to John Mark Shaver with West Virginia News.
Hi, everybody. Keeping on topic with the vaccine, will the state require the COVID-19 vaccination for all school children and or staff and faculty in the schools? And if so, will they have priority in receiving any early doses?
I really don't know that I have the authority to require that vaccine at this time now, but it's something that I'll find out, but I don't think we need to require anything. I think our people are smart and they're good and they'll make the right decisions there. But you got teams that are working on this everywhere.
All right, thank you. Next to Kelsey Soto with WSAZ.
Governor, as Brad mentioned before, Dr. Fauci said that bars are where spread is happening and not schools. What are we as West Virginians doing to get kids back in school?
Kelsey, it's limitless. I mean, I could talk to you for hours on what, the great people all across our state in the Department of Ed, through our superintendents, through our teachers, and everything that everybody's trying to get our kids in school. I have said over and over and over, the virtual learning thing is the next best thing to not much, because we know that it's not working to the level that is anywhere close to the in-school situation and how impactful that is upon our kids. Kelsey, there's no point in me just going through and trying to hit the highlights here and there. There's a lot of people that are working night and day on trying to be able to have our kids in school. And I mean everybody just about is working just on that. From the standpoint of even people that, whatever the reason that they may want to do something else and everything, I feel certain that all of our teachers want our kids to be in school, all of our administrators, all the superintendents, everybody from the medical team, all of us want our kids in school. Everybody's busting their chops trying to get our kids in school.
All right, thank you, Kelsey. Next to David Beard with the Dominion Post.
Hi, this question was posed to me, and I think it's worth passing along just in light of the surge. Talked often about all the testing we're doing, identifying super spreaders, and I understand there are privacy issues, but just in terms of bare numbers, have you in fact identified any super spreaders around the state? Can you say, just as a number, how many and about how many people you've estimated those people have infected? Thanks.
David, I'm going to take it again because I don't have any problem handling the responsibility and taking whatever it may be. But David, we've probably identified thousands, to tell you the truth, that we wouldn't have gotten before. From the standpoint of the price tag, we have not even looked at that. It's enormous. We have not even looked at it. We have the money to be able to pay for the testing, and we've proceeded to absolutely test and then continue to test. From the standpoint of identifying those that were asymptomatic, that didn't have any idea that they had this and everything, how many have we identified? Well, heaven forbid, I bet you it's in the thousands. If we hadn't have tested, would we be far worse off than we are today? You're dadgum right. You're dadgum right. But we've got to realize that this situation today, and if you don't realize it, turn the television on and look. This situation today is coming at us in every way that it can come at us. No one can identify to me that there's a battlefront that we can put General Hoyer on and stop this. We felt like that additional testing, significant additional testing, was our way. And it has been our way, but it's not enough. It's just not enough. This is coming at the state of West Virginia in waves from every different direction. Now, what I'm trying to do with all in me is not shut stuff down. I am trying with all in me to keep people safe and alive. Now, one thing we could do that would for sure, make things better is we could close the entire state, send everybody home, and things would get somewhat better. But what would be the repercussion of that too? We would lose all kinds of people there as well. We're trying to balance all that out. You know, this thing is coming at us through every way that you can imagine. And absolutely, in trying to do so, you know, I'm sick of saying that it's tough. Well, of course it's tough, you know, but as it comes at us in this way, there's no one, and Dr. Marsh and I had this discussion yesterday, you know, can you tell me, you know, what things that I can do to significantly change this other than an all-out shutdown? Well, we can come up with things we think may make some difference, just like the elective surgeries. Elective surgeries are to protect our hospital base, you know, slowing back on that. We can come up with, you know, well, we're going to shut the bars down in Mineral County. We're going to shut the hairdressers down in Wyoming County. We can do that, but we don't know. We don't know that the way this thing is infiltrating us, that's going to make a hill of beans a difference. But we know when we start shutting down everything coming or going, it's going to divide us. It's going to absolutely cause repercussion upon repercussion. And we're trying to hang on to the vaccine. That's what we're trying to do. It doesn't take a rocket scientist to figure this out. We're trying to balance the ball and absolutely make sure that we do the right thing as best we possibly can. You know, the next thing we have to look at is these bordering counties that have hours that extend beyond a neighboring state, cutting back on hours, or cutting back on indoor dining, or cutting back on the bars. We got to look at that, and we are.
All right, thank you, David. Next to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. Hi, panel. Dave Mistich, West Virginia Public Broadcasting. My question is about, you know, some of these potentially targeted approaches and more restrictions or more mitigation measures. On the maps that you guys have created, there's two metrics, and for the map that's created, it's the lesser of those two. Whenever we go to look at, you know, very targeted approaches to these measures, are we going to go with the lesser of the two, or are we going to go with a third metric? Are we going to go with something that we haven't heard of before? What's going to be the method that brings us to these decisions?
Let me make a little bit of a stab at it, and Clay, I want you to weigh in. But Dave, here, it was Dave, is that correct? Okay, Dave, from the standpoint of the lesser of the two, and I think Clay needs to tell you this, but I think I can remember enough that he can tell you too, but or I can tell you as well. I think that if we just went today with nothing but the Harvard map, we would have, if I remember correctly on what Clay has told me, we would have 49 out of our 55 counties in the red. Now, I'm telling you, if we just wanted to look at this way, you'd make my job a whole lot simpler by saying you're going to have to just close West Virginia. Well, who wants to do that? Nobody's wanting to do that, especially me. From the standpoint of balancing it, it's hard to argue how we've done. But Clay, you can join in and add a lot more to this.
Well, Governor, you're exactly right. And Dave, thank you for the question. So the real answer to that, at least in my opinion, is that we carefully watch both sides of that metric. As we've talked about before, the reason why we went away from just using an incidence rate or an infection rate, as we call it, is because the daily new number of positives was the only driver for that metric. And that, by increasing every time you found a new positive, really disincentivized counties, at least early, to do the testing. And we saw testing drop by over half to less than 3,000 average tests a day. And since we've added the percent positive, which is another accepted and good public health measure, we have seen the number of tests go up to about 12,000 a day. So, and the governor answered that very well earlier when he said we found a number of people who've spread before they developed symptoms. And so it's been very, very useful. But I think when you look at the other side of the metric, the incidence or infection rate, as the governor said, we are seeing more spread in counties that is not being offset necessarily by just doing more and more testing, which makes us know then that we really need to rely on our citizens to try to reduce the susceptibility to spread, which, as we've said many times, masks, physical distancing, wash your hands, avoid the 3 C's, et cetera. But we also have a very active group of local health departments and public health specialists like Dr. Amjad and our epidemiology team that researches and studies in each county what is driving those new cases, what is driving that spread. And the thing that the governor has responded to beautifully, I think, has been that nursing homes are our #1 place where we see spread happen. And that's where, as General Hoyer said earlier, where we see most deaths of all different sectors. It's in nursing homes. And that's the reason why we're testing multiple times a week in nursing homes. And that's been very helpful to be very aggressive about the nursing home sector. But as we continue to go, we are constantly looking for those specific areas where we can make some recommendations to the governor to make a big difference. And I think that, from my perspective and being around the governor a lot and our leadership team, this is not a simple equation, and trying to make sure that we're keeping people together yet also mitigating very specifically is what we're trying to do. So I think as we go forward, we continue to look for those opportunities and make those recommendations as we believe it could make a really precise difference in a particular county. But I think your question's is well positioned, because we do know that we need to not only test and do the contact tracing, but we also need to reduce that chain that the governor talked about. And that's going to be very important for us moving forward.
All right, thank you, Dave. Next to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Could we discuss a little bit some of the more stringent mitigation measures that are under consideration? And if it's pinpointed to specific counties, how do we avoid driving people across county lines where services are still available?
Let me make a stab at it as best I can, Phil. Phil, you're dead on the money, right? If you stop people from going to bars in Mineral County, they're going to drive across the county lines and go to a bar in a neighboring county. There's all kinds of aspects like that to consider. I'd say, and Dr. Marsh and I discussed yesterday, and we discussed just this is from the standpoint of is continuing. We monitor this all the time, but watching our neighbors in our bordering counties in our other states as far as hours and everything that they have, you know, and how restrictive they are about people going to bars. One of the things we can do is if we follow suit exactly with them, then probably you will minimize, you know, people that are in a county right across state lines from the standpoint of a bar shutting down at 10 o'clock and people from that state, you know, coming over to our bar and everything that may stay open until 2 o'clock in the morning. You know, there are some things like that that could help. My concern most about that kind of stuff is just this, is how much will it help? At the end of the day, we will put people out of work, businesses closed, we'll have repercussions like you can't imagine from the standpoint of, you know, we haven't forgotten about this terrible drug epidemic that we have, or, you know, suicide issues or whatever it may be, you know. So there's all kinds of considerations. You're exactly right. People can drive across county lines. People can drive across state lines. But Dr. Marsh, maybe you can share some of the things we talked about yesterday as well.
I think you covered it really nicely, Governor. We know that as we look at bordering counties from Ohio and Pennsylvania, then those are counties that tend to have the highest infection rates and tend to be counties that are part of this surge that we've talked about. And for instance, Wheeling Hospital was one that came up over the weekend. Ultimately, you know, the decision, as the governor has talked about, and Phil, the question you asked, it's a complex issue. We know that nationally that there are areas that have a higher likelihood of people who've tested positive having gone to, which includes restaurants and bars and gyms and areas where people remove their masks when they're together indoors. And indoors seems to be a key. And there's a paper from Nature that talks about mobility data that kind of reinforces that some areas are greater than others. But as we've talked about, our own epidemiology data would really say that nursing homes and churches and schools is where we see the most number of outbreaks, which is very few, 1 or 2 or 3 cases. But when we look at the spread, we see schools are relatively safe, and nursing homes and churches and some other places are places that have much higher rates of spread inside of them. And as we look for bars and churches, bars and gyms and restaurants, we don't see them come up reproducibly as often, but we do believe that those as a group maybe have some impact at driving some of the spread. And the governor, I think, is right that the border counties is really a reasonable and important, initial look. But I think that with all that said, the key for us is we have the power to limit the spread by each of us acting responsibly and altruistically. And it really is as simple as wear a mask and stay physically distanced and don't be around, try to minimize your movement around other people that you don't live with and crowds and indoor spaces. And if we do that well, then we won't have to do a number of mitigation measures. But that is what the governor and I talked about yesterday.
All right, thank you, Phil. Governor, I'll turn it back to you.
Okay, I appreciate all the questions. I appreciate all the interaction from our panel. I appreciate all the work that our people put in to give me a lot of the data that I'm able to report to you each and every day. I want everyone that's still on, and I know a lot of people have dropped off, but I want everyone to really dial in just a second to what I have to say here. If one of your loved ones were to get this, and they would really not be able to throw it off. Now, we all know that most people that get it are able to survive. But if one of your loved ones were to get this and they couldn't throw it off, how tough would it be? Because this has happened over and over and over. How tough would it be to not be able to go to the hospital to see them? How tough would it be to be lying there, possibly dying or possibly just gasping for breath, and none of your loved ones can even be around you? It's tough. It's really tough. And all of us need to realize even more that right now this situation is even tougher. If that's not enough, how tough would it be to have a loved one that's in a nursing home that so badly needs their family to be able to come and see them? And maybe it's been months upon months upon months, and they can't even embrace with their kids or their grandkids or whomever it may be. How long are we going to stand idly by and let those people continue to suffer? And what can we do? But what we can do is what everybody continues to plead over and over and over with what we can do. What we can do today is wear masks. And yet we still have a good many people that are hell-bent against that, because supposedly it may be their liberty. Well, in my opinion, their liberty does not include taking a risk with somebody else's life. Now, if they want to walk off a cliff and everything, they can do so. But I don't think they ought to be able to walk off a cliff and drag others with them. Now, from a standpoint of all West Virginians out there, for the most part, understanding, yeah, I think that all West Virginians do, and I'm very, very, very thankful for what you do each and every day. The bottom line of this thing is just this. And here's the thing you need to listen to Jim Justice to better than anything, period. The bottom line is we can't stop this today. All we can possibly do is cut this thing off at the pass if we can stop the chain reaction of what's going on. Now, there's a vaccine on the way. I don't know why in the world our medical team or myself needs to sit here day after day and plead with everyone to do everything they possibly can in their power to stop the chain reaction until the vaccine gets here. I'm telling you, West Virginia, you have done marvelous. And I love you more than good sense. I love you with all my soul in every way. And absolutely, I'm going to continue as long as God gives me breath to try to help each and every one of us in this state to try to get through this and to try to tackle all of our issues and problems. We have been blessed beyond belief from God above. But with all in me, I've got to tell you over and over, you are within days of a vaccine that is our hope right now. This is your power today, a mask, to be able to help. Absolutely do the smart things that we plead with you about each and every day. We plead with you about the elderly going to church, or the pew in between you, or helping it go to the grocery store for someone, or whatever it may be. But West Virginia, I am telling you with all in me that we can make adjustments that will help a little. But we can't make the adjustments that will help the most without massive shutdowns, without you wearing your mask all the time, without the vaccine. We know, I know what we got to do. You just got to do it. Thank you so much.